Hello, everyone. This is Cheryl Baltazar. I'm a nurse practitioner in movement disorders neurology. And today I wanted to talk about the three most common symptoms that could be suggestive of Parkinson's disease. Remember that my videos are for educational purposes only. We're here to talk about symptoms to help you in between your doctor's appointment. My videos don't replace the medical advice of your doctors. So please reach out to them about your specific symptom. I wanted to talk about this today because most people think that Parkinson's disease begin when they see tremor or shaking and slowness of movements. But actually, there have been decades of changes in the brain that has been happening already before you develop these movement symptoms. So we call these symptoms that I'm going to share prodromal symptoms, suggestive of PD or the family of that synuclein abnormality. The first is the lack or change in your sense of smell. And I know that there are other things that can explain these, such as smoking, chronic smoking, or sinus surgery, or COVID is the most common. But remember, these symptoms, this specific symptom, if you take it and combine them with the other prodromal symptoms, along with your clinical features, this is very suspicious. There's actually a like a smell test challenge that's posted in the website of Michael J. Fox organization. And you can check that out for yourself if you live in USA or Canada. I believe that's for free. But in the office, we do like a sniff test, or sometimes we take the subjective complaint about it. At home, you can try and use citrus or alcohol related products or cinnamon, those spices. They should smell strongly. And if they're muted, then that's suspicious. The next symptom is REM behavior disorder. REM behavior is rapid eye movement. It's part of the sleep cycle, and it's a disorder if you act out your dreams. So in REM cycle, in this part of the sleep cycle, you dream vividly and the eyes move a lot, hence we call rapid eye movement. And the brain activity is actually kind of similar to when we're awake. This is when we're sleeping. So there's a part of the brain that controls the muscles of your body so you don't move when you're having vivid dreams, and that's normal. The abnormal part is, so when we call REM behavior disorder, is when you're able to act out those vivid dreams. So people can flail their arms or kick or hit the bedmate, or sometimes worse, fall out of bed because of the vivid dreams. They can happen decades before the presentation of movement symptoms. And the REM behavior disorder actually can be treated, and make sure that you bring this up to your provider if you are experiencing this. Sometimes we follow individuals in the office, even though they are not diagnosed with Parkinson's. If they have this symptom, we can follow them in the clinic and see how they do over time, because they are very, very suspicious, and we have to rule out other things that can result to this, like such as medication or sleep apnea. There are other things that we have to make sure you don't have. Why are you having this abnormality? The third one is chronic constipation, and chronic constipation is very problematic. People would have had it since young adulthood and would have tried a lot of things or treatments to improve this. Um, this can sometimes be exacerbated, or this can be exacerbated after the diagnosis of PD because of the medications that we use. So those three prodromal symptoms, which are the lack of sense of smell or decreased sense of smell, REM behavior disorder or acting out of vivid dreams, and chronic constipation, when you pair them with changes in your movements, they can be very suspicious. So make sure if you or your loved one or your family member, your parents are experiencing these symptoms, bring this up to your doctor. Maybe it's worthwhile to get checked. And again, if you have any comments, you can post them below. I'll see you in the next video. Bye-bye.